We examined over 1,000 individuals with colorectal cancer who were seen at the Dana-Farber Cancer Institute for treatment of their colorectal cancer, and who ultimately consented to participation in a sample registry. We were really looking to try to understand what the prevalence of hereditary cancer susceptibility syndromes is in this patient population. Data that are out there suggest that there's probably about a 3% prevalence of Lynch syndrome in colorectal cancer patients, but these data have been primarily ascertained from looking for specific high-risk features in the colorectal cancer patients themselves. Things such as tumor testing for mismatch repair deficiency and high-level microsatellite instability. So we really were trying to go into this looking at patients without any sort of pre-selection, and to test them beyond just Lynch syndrome, to test them for Lynch syndrome mutations, but also for mutations linked to other hereditary colorectal cancer syndromes, as well as other hereditary cancer syndromes that are not necessarily known to be linked to colorectal cancer risk. I think we certainly need to look more into the significance of some of these surprise mutations. There are a lot of genes that we are now testing for where I don't think we understand the full spectrum of cancer risk that mutations in these genes confer. And so understanding really the full phenotypic spectrum as well as the magnitude of risk conferred by some of these mutations is going to be critically important to helping patients and providers understand how to interpret these results. And I think furthermore, even the genes that we think we do understand well, we're learning that the spectrum of cancer risk linked to them may be wider than we traditionally thought. And I think we need larger studies looking at specifically whether or not these mutations mean the same things when you find them in a non-traditional fashion, such as finding a BRCA mutation in a colorectal cancer patient.